WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
In March 2020, the World Health Organization declared the coronavirus disease a pandemic. Today, we'll take up discussions about things we can do or we can contribute as a student to help the government in the fight against the coronavirus disease. Now, before we go into our main concern, we will first take a look at what really is this virus that caused countless havoc worldwide. In December of 2019, the Chinese government brought news to the world that a certain disease was spreading rapidly in their communities. Not months after, it spread to other countries with numbers increasing significantly within days. This virus is the severe acute respiratory syndrome related coronavirus 2, which causes the disease called COVID-19 and that everyone simply calls coronavirus. The virus may spread through surfaces, but it's still uncertain how long it can survive on the open. Its main way of spreading seems to be droplet infection when people cough, or if you touch someone who's ill and then you touch your face, say rubbing your eyes or nose. The journey of the virus starts here, and then go deeper into the body. Then it mainly goes into the intestines and the lungs, which can have the most dramatic effects. Taking up even a little amount of coronaviruses can cause quite a dramatic situation, and might get so bad that it can cause permanent irreversible damage that leads to lifelong diseases. The majority of people infected by coronavirus will get through it with relatively mild symptoms, but many cases become severe or even critical. Based on the update of the World Health Organization, as of July 2020, coronavirus cases reaches approximately 11.9 million with approximately 540,000 deaths and approximately 6.8 million recoveries. Specifically on our country, the Department of Health as of July 2020 confirms approximately 47,000 cases with approximately 1,300 deaths and approximately 12,000 recoveries. The virus reached the Philippines on the 30th of January 2020, when the first case of the disease was confirmed in Metro Manila. It involved a 38-year-old Chinese woman who was confined in the San Lazaro Hospital in Manila. The second case was confirmed on February 2, 2020, involving a 44-year-old Chinese man who died a day earlier, which was also the first confirmed death from the disease outside mainland China. After a month without recording any cases, the DOH confirmed its first local transmission on the 7th of March 2020. Since then, the virus spread to the country with at least one case being recorded in every region. On an article on the WHO website titled 100 Days of COVID-19 in the Philippines, it was stated that the Philippines implemented various actions including community quarantine on cities and towns with the highest risk of spreading the disease. Due to this health issue, the government have temporarily closed educational institutions in an attempt to contain the spread of coronavirus. The crisis has affected about 27 million learners, 1 million teachers and non-teaching staff, as well as the families of the learners. The disruption caused by COVID-19 has forced the adoption of online learning in schools. Students from all levels were advised to stay at home. Amidst the global-scale pandemic, it's easier for common people to feel helpless. Even us students felt the same way at a time. Well, even though we're still students, we can make a difference. Even if we're quarantined at home, there are still many ways to get involved and give back. The easiest way to give back is by reaching out to the people you know. Neighbors, friends, co-workers, and relatives can all benefit from a friendly text or video call. It may seem like a small gesture, but don't underestimate the positive impact of checking up on someone. Start with those who might feel vulnerable right now. This could be your elderly neighbor who is cut off from their social connections, or your friend who suffers from anxiety and depression. Providing a touchstone for someone during this time is one of the best ways to be of service, and it will help ease your own anxieties as well and give you an emotional boost. While many people don't have extra funds right now, you're one of the lucky ones who do. Consider donating to an organization that's making a difference during the pandemic. Some possibilities include hospitals and health centers, or national and local charities that could provide housing, financial assistance, or food. If you're strapped for cash, there are ways to donate without spending huge amounts of money. With more people out of work, the demand for food stocks is expected to rise. At the same time, panic buying and hoarding have reduced supplies. While the best way to help is through support financially, you can also help by donating non-perishables like canned goods, rice, and instant noodles. Hospitals and healthcare centers are still facing shortages of personal protective equipment such as N95 masks and surgical masks. If you have some to spare, you can donate through organizations recognized by the Department of Health. Right now, some individuals have difficulties of acquiring toilet paper, rubbing alcohol, hand sanitizers, bleach, and disinfecting wipes. If you have more than what you need, see if a local food store in your area or anyone in your neighborhood that could make use out of it. Spending more time at home might give you a good opportunity to clean out your closet or take on other decluttering projects. Fewer people are donating blood at this time, which means the Red Cross is facing dire shortages. And as coronavirus cases continue to increase, the number of eligible donors has dropped. While many of us has been warned against non-essential errands, the Red Cross and other blood banks have remained open with safety precautions in place. Get creative with ways you can help out. Chances are, you have a talent that can be of service right now, like sewing. As hospitals are facing a shortage of personal protective equipment, some are asking for homemade masks. This is a great way to help out on the front lines. During these trying times, the government is struggling in the fight against the coronavirus. The best possible way to contribute is to stay at home. What should we do at home? Practice social distancing and self-care. Do not underestimate how much you're helping by simply following public safety guidelines. Even by just staying at home as much as you can and practicing social distancing when you do go out, you are making a vital difference in your community. Making an effort to stay healthy and avoiding high-risk activities will lower your own chances of contracting the coronavirus. This in turn will keep others from getting sick and overwhelming of the healthcare system. So, what is the best thing you can do to help the government to the fight against the coronavirus? Take care of yourself.